Hello friends, in the previous video of pathophysiology of hypertension, we had discussed about humoral mechanism as well as neuronal mechanism to maintain and regulate the blood pressure. Today, we will be discussing about peripheral autoregulatory mechanism which controls the blood pressure at the local or peripheral level. Now, in the peripheral autoregulatory mechanism, it is very important that it will control the blood pressure at the capillary level. Whereas, in case of humoral as well as neuronal mechanism, it will control the blood pressure in the artery or arterioles or vein or venules. Primary mechanism to control the blood pressure is humoral as well as neuronal mechanism. But up to some extent, peripheral autoregulatory mechanism is also responsible for maintenance of the blood pressure, or in other words, maintaining the blood flow throughout the body. Now, in order to understand, there is a regulation of blood pressure in the human body via certain mechanism. There is a long-term regulation as well as short-term regulation, which is also known as acute regulation of blood pressure. Now, when we discuss about acute regulation of blood pressure, it is having different sub-unit which is controlling the blood pressure via extrinsic pathway, via intrinsic pathway, and via vascular pathway. Today, we will be discussing about peripheral autoregulation, in which intrinsic pathway of acute or short-term regulation of blood pressure, how it can affect the blood flow as well as blood pressure. In intrinsic regulation of blood pressure, there are two hypotheses or theory, that is metabolic theory as well as myogenic theory. So let's discuss about metabolic as well as myogenic theory of peripheral autoregulation. Now, in order to understand the blood pressure via peripheral autoregulatory mechanism, we need to understand the blood flow first. So, blood flow is differently having different rate of flowing the blood in the different organs. So, I have explained over here that depending on the organs and requirement at different situation, there is a deviation in the blood flow, and this deviation in the blood flow at the different situation will be maintained by the peripheral autoregulatory mechanism. So when we discuss about pathophysiology of hypertension, there is a defect. There is a defect in peripheral autoregulation, leads to imbalance in the blood flow in different situation in the different organs, which leads to persistent elevation in blood pressure, and person will suffer from hypertension. So in heart and brain, in the resting condition, blood flow is somewhere around 250 and 750 ml per minute respectively. As a person start doing exertion, in heart there will be rise in blood flow, and if the person is doing maximal exertion, the blood flow is highest. So it will be around 250 in resting condition, 350 in mild exercise, 750 in strenuous or maximal exercise. Whereas in case of brain, blood flow remains constant. Whether a person is thinking, whether a person is sleeping, or whether a person is awake, there is no change in blood flow in the brain area. In case of gastrointestinal tract, the blood flow remains high in the resting condition and low in the exertion condition. Similarly, in liver and spleen, blood flow remain high in the resting condition, blood flow will decrease upon exertion. In kidney, there will be high blood flow while the person is resting. Blood flow gets decreased when the person start doing exercise. In integument system, that is skin, there will be minimal blood flow during the resting condition. As person is starting exertion, there will be a generation of heat, and in order to maintain the body temperature, there will be the heat will be maintained, or the body temperature will be maintained via generation of perspiration, and that is why upon exertion there will be rise in the blood flow to the integument system, that is skin, where or hair, there will be rise in blood flow. So here I have mentioned what will be the change in flow in different organs in different situation. Now if we want to understand the flow depends directly on the change in pressure as well as resistance. So pressure will be directly correlated with the blood volume, and resistance is directly correlated with the viscosity of blood. So if viscosity of blood if increases, there will be increase in resistance, there will be hindrance of a blood flow. Or when there is a increase, when there is a decrease in diameter of artery, there will be again narrowing of the lumen, that will also lead to increase in resistance and decrease in the flow, because resistance is inversely proportional to the blood flow. If there will be rise in pressure, there will be smooth rise in the blood flow as well. So this is a basic concept of blood flow in the different organs. Now let us understand the metabolic theory first. So as per the metabolic theory, what will be the difference in the blood flow at the different juncture? So let us understand the concept of blood flow first and adjustment of diameter of the blood vessels in different situation or throughout the body. So if we plot a graph of blood flow, which is ml per minute versus mean arterial pressure, that is millimeter of mercury, then in the initial stage there will be rise in the blood flow along with the pressure. At certain juncture there will be constant blood flow, even the blood pressure is rising, and after a certain time there will be again rise in blood flow with the rise in blood pressure. So if, say for example, at this juncture the mean arterial pressure is 70 millimeter mercury, and at this juncture the blood pressure is 170 millimeter per mercury. So what will happen is, during this initial phase, when there is a rise in pressure, along with the rise in pressure there will be maximal dilation of the artery or vessel as well. As the pressure is increasing, there will be a maximal dilation of the artery, and because the pressure is increasing and the dilation of the artery is maximal, the artery cannot further dilate. So upon increase in the pressure, there will be increase in the blood flow as well, because the artery is maximally dilated, it cannot now dilate more. So if you keep on increasing the pressure, diameters got stagnant, and because the diameter is maximal, now the vessel cannot stretch more, there will be, upon rise in the pressure, there will be rise in the flow as well. After this juncture, there will be little bit constriction of the artery, and the artery gets constricted compared to the earlier phase. Upon increase in the flow, increase in the pressure, mean arterial pressure, for a certain period of time, there will be no increase in blood flow, because the diameter of the artery again got stagnant. So during this period, there will be no change in the flow, even though there is a rise in blood pressure or mean arterial pressure. After certain time, there will be, now artery is constricted a lot, and if there will be rise in pressure, there will be rise in flow, because the diameter of the artery at this juncture is minimal. Here the diameter is maximum, here the diameter is minimal, here the diameter of the artery or veins or venules got fluctuated based on the oxygen demand. So that we will be discussing in the metabolic theory, that during this juncture, why there is no change in the blood flow. There is a change in blood pressure, but there is no change in the blood flow. This is a, if you extend over here, this is a blood flow, this is mean arterial pressure. This mean arterial pressure is increasing from 70 to 170 mmHg, but there is no change in blood flow because of the metabolic theory. So let's understand the metabolic theory over here. So metabolic theory says that when the artery, and this is the arterioles, this is the venules, these arteries are supplying the blood to the capillaries. This is lower capillaries, this is upper capillaries, and these capillaries are perfused in the vital organs. And here from the arterioles, this juncture, this point is called pre-capillary sphincter. This is pre-capillary sphincter, which will open and close based on the metabolic activity occurring inside the cells. Say for example, vascular smooth muscle. So in the vascular smooth muscle, there will be opening, so in certain case there will be opening of pre-capillary sphincter, and in certain condition there is a closing of pre-capillary sphincters. So when there will be opening of pre-capillary sphincters, there are certain conditions in which there will be opening of this pre-capillary sphincters, which allows the blood flow to the capillary fully or maximally, and the blood will reach to the vital organs or cells where it delivers the oxygen, and there will be no disturbance in the aerobic metabolism. And because there is no disturbance in the aerobic metabolism, there will be no generation of metabolites which will be further responsible for vasodilation. So let's say, for example, if this is a cell, this cell is not getting sufficient oxygen. Oxygen, as we know, is necessary for aerobic metabolism. If this cell is not getting oxygen, the aerobic metabolism got disturbed and cell starts producing certain metabolites like adenosine, potassium, hydrogen. These are some metabolites which are generated by the cells when there is no oxygen supply. These all metabolites, these all cellular metabolites are responsible for opening of pre-capillary sphincters. This is how this oxygen level upon dilation of the blood vessel got restored and cell will get oxygen. Cell basically required oxygen, glucose and removal of waste material. Otherwise, there is no change or there will be no cell mediated or peripheral autoregulation of diameter of the arteries or venules. So this is how this pre-capillary sphincters is connected with the oxygen supply to the cells or vital organs. So in which condition it will promote the opening of pre-capillary sphincter? When the cellular metabolites will be generated. So whether there will be decrease in oxygen or increase in carbon dioxide, that is one situation which will promote the opening of pre-capillary sphincter and increase the blood supply. Second is increase in lactic acid, which is again a cellular metabolite. Increase in potassium or hydrogen, which will decrease the pH. So this condition also favors the opening of pre-capillary sphincter and restore the blood supply to those area. Increase in histamine, increase in body temperature, as well as release of nitric oxide by the endothelium. So this nitric oxide is released by the endothelium when there is a decrease in the blood supply or oxygen supply to certain part of the body. This nitric oxide is potent vasodilator which will facilitate the blood supply to that area, and it will supply or it will try to adjust with the demand. So this is how the pre-capillary sphincter got activated and open, and the supply will be restored to the certain part where this capillary is supplying the blood, especially oxygen and glucose, and taking back the waste material or metabolite. In certain condition, there will be closing of the pre-capillary sphincters, which are maybe certain condition are exact opposite to this condition, but especially when there is a increase in vasoconstrictors, certain prostaglandins when secreted in the blood, it will do vasoconstriction, which will close the pre-capillary sphincters. In certain condition, there will be rise in blood supply to the certain part of the body or certain organs or cells, which leads to damage to that cells because of high blood pressure, because of high blood flow. And there is a requirement of closing pre-capillary sphincters to avoid or to decrease the pressure in the certain cells, tissue or organs. And that is where closing of pre-capillary sphincter will also play a vital role. That are when there is an increase in endothelin, increase in leukocytes, or increase in platelet secretions, along with some prostaglandins which are vasoconstrictors by nature. These prostaglandins along with platelet secretions, leukocytes or endothelin will be responsible for the closing of pre-capillary sphincters, and the blood flow get decreased to those pre-capillary areas and the capillaries which is supplying blood to the cells, tissue and organ, and it will try to maintain or prevent the organ or tissue damage. So this is how this metabolic theory or chemical messenger theory helps to regulate the blood pressure by changing the diameter of these capillaries, which we have discussed with the help of this chart, where there will be certain rise in the blood flow along with the rise in pressure. After some time, there will be a plateau phase, because during this particular phase, there will be certain fluctuation in the diameter of the arteries depending on the demand and supply. So when there will be less oxygen, there will be dilation of this artery. When there is a high oxygen, there will be narrowing of this artery. So because based on the oxygen, based on the waste material or metabolites generated by the cells, there will be increase or decrease in the size of this capillary, will be adjusting the blood flow constant throughout the period. But after some time, if there will be a narrowing of fully narrowing of the artery, there is no further scope of narrowing of that artery, then there will be rise in flow with the rise in pressure, because now the artery or vein cannot constrict more. So this is how this metabolic or metabolite theory is justifying the autoregulation in the local organs, tissues or cells. In the next session, we will be discussing about myogenic theory. Let's discuss the myogenic theory. Now, the myogenic theory is basically stretching of the vascular wall which is present in the smooth muscle of arteries as well as veins. So in response to the perfusion of a blood in different parts of the human body, there will be change in the stretching of this vascular smooth muscle, and depending on that, there will be relaxation or constriction of the blood vessel, and the blood supply and blood flow is maintained throughout the human body. So it is basically a protective function which will help to maintain the perfusion in the vital organs while fluctuation in the blood pressure as well as blood flow. So let's understand, as per the myogenic theory, when there is a decreasing in the blood flow or blood pressure in certain part of the body, there will be decrease the stretch on the blood vessel. So say for example, this is a blood vessel which is supplying the oxygen to the cells, right? So when this oxygen netted blood is flowing from this vessel, there will be supplying of oxygen to the cells for the aerobic metabolism. But sometimes there are some hyper excited cells which requires more oxygen compared to the normal cells. So this oxygen will be consumed more by the hyperexcited cells. Say for example, this is a hyperexcited cells which requires more energy, more oxygen and more metabolism because of the hyperactivity, and that will consume the oxygen from the vessel, and because of this reason there will be no oxygen available for this resting cell. And due to this reason, say for example, this resting cell is smooth muscle. Okay, so in this condition, there will be no oxygen or less oxygen is available for this cell. Now, because of this less oxygen, there will be decrease in ATP generation. When there is a decrease in ATP generation, the actin-myosin concept of vascular contraction, when the actin-myosin ligament binds, then there is a requirement of ATP for the stretching of the walls or for the stretching of the cells. That will not take place, and there will be decreased stretch on the blood vessel because of the decreased blood flow, or there will be decrease in the concentration of oxygen in the blood, which will not be sufficient to supply or to fulfill the demand of a normal cell, will lead to decrease stretch of blood vessel, promote relaxation and increase the perfusion via facilitating. So this diameter got increased and the blood can penetrate more with more oxygen, and this cell will get oxygen, and this cellular metabolism will take place via increasing the perfusion. So the demand in the cell can be fulfilled, and there will be a regulation of blood flow via this mechanism. When there is an increase in blood flow or pressure to certain part of the body, it will also lead to damage to certain tissues or cells. in this condition, there will be increase the stretching of blood vessel, there will be a vasoconstriction, and there will be decrease in the perfusion, because already blood flow is high. When this blood flow is high, the vessel got constricted. So maximal blood cannot come inside the vessel and cannot reach to the destination, and ultimately to the vital organs there is a decrease in the perfusion, because the increase in blood flow will also try to damage the vessel or cells if it is more than necessary. So that will be compensated by decreasing the perfusion. So myogenic theory is depending on the cellular and tissue demand of oxygen or blood, will change the diameter of the artery as well as vein and control the blood flow throughout the body in different situations. So this is about peripheral autoregulation via metabolic as well as myogenic theory. Now in certain cases, this blood flow and blood pressure is basically depends on the blood volume, and this blood volume is mainly depend on the kidney, because kidney is filtering the blood and maintaining the blood volume via excretion of sodium and water. And in certain cases, when there is a lack of blood volume or when there is insufficient blood volume, retaining the sodium as well as water. So this blood volume is depend on the urinary system, mainly on kidney. In some of the patients, there is an intrinsic defect in sodium excretion. When there is an intrinsic defect in sodium excretion, sodium will retain inside the human body, and as the thumb rule, sodium will also retain the water, and sodium water retention will increase the blood volume. And as we had discussed earlier, increase in blood volume will be directly responsible for increase in the blood flow as well as blood pressure. And that is why this peripheral autoregulatory mechanism, because of intrinsic defect in sodium excretion, will be defective, and this regulation will not take place and lead to high blood pressure. So this is about peripheral autoregulatory mechanism and how it will control the blood pressure by controlling the blood flow in the capillary region, and how the defect in the peripheral autoregulation leads to elevation in the blood pressure. In the next video, we will be discussing about vascular endothelial mechanism. So in that we will discuss about certain cytokines and certain enzymes secreted by the vascular endothelium and how it will affect the vasoconstriction as well as vasodilation and blood pressure. Thank you. Keep watching, keep learning, keep growing.